Maybe their defense should be inclusiveness. After all, in a just world, why should hospice be only for the dying? Last week, federal agents swarmed out across Southern California to arrest 8 defendants as a part of a sweeping healthcare fraud takedown nicknamed Never Say Die. The U.S. Attorney's Office for the Central District of California charged those 8 for their roles in various schemes resulting in an alleged greater than $50 million in fraudulent Medicare billing through sham hospice facilities, billing for patients who were not, in fact, dying. Here's how the schemes are said to have worked. Hospice care pays providers a daily rate for patients certified by a physician as terminally ill with 6 months or less to live. The defendants allegedly turned that definition into a recruitment opportunity. Marketers approached healthy people at grocery stores and parking lots. The pitch? Sign up, you're now terminally ill, and don't worry about a thing. Medicare covers everything, plus you'll get $300 a month in cash, delivered in an envelope, plus free nutritional shakes, vitamins, and a wheelchair that you don't even need. One operator, licensed vocational nurse Lolita Baronia Menard of Topanga Hospice Care, Inc. in Artesia, California, is alleged to have run her business this way for 5 years, billing Medicare $9.1 million and collecting $8.5 million. Her fatal tale, Topanga's non-death discharge rate was approximately 85%. The national average is 17.2. Nearly 9 out of 10 of her terminal patients were apparently going to be just fine. The Gill case adds texture. Gladwin Gill, described as a purported psychologist, and his wife Amy Lou, a nurse, ran 626 Hospice in Glendale, California, which operated under the name St. Francis Palliative Care. They're alleged to have submitted $5.2 million in fraudulent claims, collected $4 million, and laundered the proceeds into mortgage payments, car payments, international flights, and restaurants. The most remarkable defendant, though, is Nita Almuete Padit Palma, 76. Ms. Palma was already incarcerated in a federal prison in Seattle, awaiting trial on a separate hospice fraud case when she and her husband allegedly opened 3 more fraudulent hospice facilities. She is already a thrice convicted healthcare fraudster. A few takeaways worth your attention. The hospice benefit is currently among Medicare's most audited programs. Daily rate billing, physician certification of terminal status, and referral patterns are all under active scrutiny. If your signature appears on hospice eligibility certifications, live discharge rates and patient addresses will eventually get reviewed. And if a marketer approaches you with a stack of referrals and mentions compensation, that's not a referral relationship. That's an anti-kickback statute violation wearing a business card. If you want to live to see another day, you'll consider putting your signature on shady eligibility certifications or accepting anything in return for them as dead on arrival. Stay tuned. There's always more fraud to unpack next Friday.